This is for nasotracheal suctioning. So we have been notified that the patient needs to have some suctioning completed. They have a nasal airway in place. We would check the patient's chart and make sure the order is there. We would make sure that the room has suction hooked up and ready to go, that the oxygen source is there and our device is available, and that we take our sterile suctioning kit to the room. So we would walk to the patient's room, knock on the door, introduce ourselves, sanitize our hands. Hello, Mr. Blank. My name is Trisha, and I'm with Respiratory Care. Today we're going to do some suctioning. You have that airway through your nose. They're helping you breathe, so we're going to help you remove some secretions that have built up there as well. So we're going to use a small catheter and insert that in the nose there and go ahead and get that out. It's just a very quick procedure, so it doesn't take very long. But first, can I get your name and date of birth? Okay, so we've verified the patient. I will do my assessment. I will get vital signs. Feel the patient's chest, because you may be able to feel those secretions on the chest there just by feeling. Get the oxygen level, and we're going to place the pulse oximeter on the patient's hand and put it somewhere visible so that we can watch it the entire time we're doing this. If at some point it begins to drop the oxygen level, we want to stop what we're doing. So Mr. Blank, first I'm going to put some oxygen on. We'll put this mask on and put you at 6 liters here for just a few minutes while we're getting everything ready. We want to make sure you're good and oxygenated. So that is on the patient. Then we're going to open our sterile suctioning kit. So we have opened this. This contains our nasal the catheter we're going to use. We have sterile saline ready to go, and then we have some lubrication in that kit as well. And we're going to put the sterile gloves on. We're going to try and keep one sterile hand and one clean hand. Prior to doing this, we're going to make sure that we have our suctioning turned on. So we've got the suctioning in the wall. We've turned it on to negative 100 to 120 because this is an adult patient. So we have our gloves. We are sterile. We are going to open the lubrication. We're going to either put it on top of the lid inside that sterile kit so that remains sterile, or put it on our glove. Grab that kit or that catheter, attach it to the suctioning, and then we're going to make sure that it's working properly. So here's where the sterile saline would come into play. We would dip the catheter into the saline and plug that thumb port there. Then we would watch that saline come up into the catheter. That would ensure that the suction is working properly, and it is working properly. So then we would lubricate the tip of the catheter either through the palm of our hand or at the top of that suctioning kit there. Then we're going to remove the mask. So Mr. Blank will remove that mask and we will get started. I just need you to breathe nice and easy, be as comfortable and relaxed as you can through this process. If you don't cough, I'll make you cough, so I will instruct you at some point. So, all right, we're going to get started. So we would insert this through the nares. Keep that advancing. The first resistance that we feel, that's when we would instruct the patient to cough. Go ahead and give me a cough. That pushes it through the vocal cords. Second resistance we're going to feel is the carina. At that point, you're going to pull back slightly, occlude the thumb port, and start twisting that catheter. You're going to twist that catheter as you're removing. We want your finger on the thumb port less than 10 seconds. So we're occluding, twisting, removing. That entire process should take less than 15 seconds in total. At this point, I'm going to go ahead and feel the patient's chest again. Leave that suctioning going. Keep this into your sterile hand. Go ahead and place your hand on that chest, and we have removed all those secretions. So then we would get rid of the suction catheter, put oxygen back on the patient for 1 minute. If we still felt those secretions, we could go back in one more time to try and get those secretions removed. We only want to do this 2 times in one setting, so that would be our max. So we've put oxygen back on the patient for 1 minute. Go ahead and remove that. We would answer any questions that Mr. Blank has, make sure he is comfortable, and then we would document what we've completed.